Welcome back to part 2 of our gastrointestinal assessment series. In our previous section, we covered preparation and systemic inspection. Today, we focus on the hands-on components, palpation, percussion, and auscultation, concluding with the essential steps to complete a professional GI physical examination. We begin palpation with a gentle and systemic approach, from superficial to deep. First, we could lightly assess the 9 abdominal regions. We are feeling for areas of tenderness, guarding, and muscular rigidity, which can indicate underlying inflammation. We then repeat the process with deeper pressure to visualize the underlying anatomy and detect any masses. There's a crucial tip that throughout both stages, always maintain eye contact and watch the patient's face for signs of discomfort or wincing. If you detect a mass, you must categorize its size, surface, shape, edge, consistency, and tenderness. To determine if a mass is intra-abdominal or within the abdominal wall, ask the patient to raise their head and shoulders off the pillow. If the mass becomes more prominent during this contraction, it is likely within the abdominal wall. If it becomes less prominent or disappears, it's likely intra-abdominal. Palpate for specific organs. Palpation for the liver should commence in the right iliac fossa. The patient should be asked to take a deep breath whilst the examining hand palpates deeply to feel the descending edge of the liver being pushed down by the diaphragm. Whilst the patient breathes out, the examining hand should be withdrawn and repositioned slightly nearer the costal margin, whereupon the process should be repeated. The liver can normally be palpated up to 1 cm below the right costal margin on deep inspiration. For the spleen, again, start in the right iliac fossa and move toward the left costal margin as the patient breathes deeply. The spleen is typically only palpable if it has enlarged to 2 to 3 times its normal size. Kidneys should be examined by a technique called ballottement. The anterior hand should press deeply, lateral to the margin of the rectus muscle in the upper quadrant of the abdomen. The posterior hand should be placed in a costal vertebral angle and should be used to lift the kidney up against the anterior hand repeatedly. The lower pole of the right kidney may be palpable in thin normal people, while the left kidney is rarely palpable. For the aorta, palpate the supra-umbilical midline. An expansile pulsation suggests an abdominal aortic aneurysm. To conclude palpation, palpate the suprapubic region for a full bladder. Check the femoral pulses, and if you suspect acute cholecystitis, ask the patient to breathe out and then gently place the hand below the right costal margin and the mid-clavicular line, which is the approximate location of the gallbladder. If inspiration is prevented by the inflamed gallbladder coming into contact with the examiner's fingers, we consider a positive Murphy's sign. Finally, palpate for inguinal lymph nodes. Now we percuss the abdomen, which helps us determine the size of organs and the presence of fluid. We start with the liver. Percuss from resonance to dull to identify the superior and inferior borders. For the spleen, we use Castell's method by percussing the lowest intercostal space in the left anterior axillary line during both full inspiration and expiration. And then for the bladder, a dull note in the suprapubic region may indicate an enlarged or full bladder. If you suspect ascites, percuss from the center toward the left flank until it sounds dull. Have the patient roll onto their side and wait 10 seconds. If the note becomes resonant, fluid has redistributed. And this is what we call the shifting downers, and then we can confirm the ascites. Auscultation provides clues about bowel motility and vascular health. We listen to bowel sounds. Normal sounds are gurgling. Tinkling sounds may suggest a small intestinal obstruction, while a total absence of sounds after listening for at least 2 minutes may indicate a paralytic ileus or peritonitis. Finally, listen for vascular bruits over the aorta and femoral arteries, which may indicate stenosis. To finish the GI examination professionally, remember the eye-struck mnemonic. So it is inguinal lymph nodes, stools, hernial orifices, rectal examination, urine, genitalia, and at the end, you must thank the patient and request them to redress and wash your hands.